my dear doctor, I'd like to discuss a topic that is lithium. Lithium is a mood stabilizing drug used most commonly prophylactically in bipolar disorder, but also as an adjunct in refractory depression. So what do you need to do? You just make circle the bipolar, you circle the depression, means the refractory depression. It is a very narrow therapeutic range, that is 0.4 to 1 millimole per liter, and a long plasma half-life being excreted primarily by the kidneys. So yes, make circle 0.4 to 1 and a long plasma half-life, so circle long half-life. Mechanism of action not fully understood. Two theories are there that interferes with the ionocetyl triphosphate formation. So circle interferes with the cyclic MP formation. So circle the interferes. Adverse effects are the nausea, vomiting, diarrhea. Yes. Fine tremor. So circle the tremor. Polyuria secondary to nephrogenic diabetes insipidus. Thyroid enlargement may lead to hypothyroidism. ECG, T-wave flattening, and sometimes inversion. Weight gain. Monitoring of the patients on lithium therapy. Inadequate monitoring of the patients taking lithium is common. NICE and the National Patient Safety Agency, NPSA, have issued a guidance to try and address. As a result, it is often an exam hot topic. Lithium blood levels should normally be checked every 3 months. Levels should be taken 12 hours post-dose. Thyroid and renal function should be checked every 6 months, and patients should be issued with an information booklet, alert card, and record board. So my dear, lithium is a very, very hot topic for the exam. Lithium toxicity. Lithium toxicity generally occurs following concentration greater than 1.5 per liter. So circle greater than 1.5. Toxicity may be precipitated by dehydration. Circle dehydration, renal failure. Circle renal failure. Diuretics, especially benzoflumethiazide. So circle the diuretics. ACE inhibitors. Circle ACE inhibitors. And metronidazole. Circle metronidazole. Features of toxicity: cold tremor. A fine tremor is seen in the therapeutic levels. Acute confusion, seizures, and coma. Management: mild to moderate toxicity may respond to volume resuscitation with the normal saline. Hemodialysis may be needed in severe toxicity. Sodium bicarbonate is sometimes used, but there is a limited evidence to support this. But increase the alkalinity of the urine, it promotes the lithium expression. So yes, my dear doctor, I'd like to talk and the SS boxes, how the lithium and the lithium toxicity, that we can understand very, very well, and the exam questions will come up. So yes, let me start by giving some of the boxes of lithium toxicity. So let me start by giving the box of SS box. Once again, that is lithium. So lithium is an indication of the mood stabilizing drug, most commonly prophylactic in the bipolar disorder. So lithium is used as a prophylaxis with the bipolar disorder. Just write it down. And refractory depression. So this is a single box that we need to remember. Next point is really important, right? I'd like to give the lithium SS box, the one of the most important box of lithium. So I'm saying the lithium, all the features of lithium can be remembered by giving only the mnemonics of the lithium itself. So let me start by giving the lithium. So just say with me L with the long plasma half-life. So we can say L for long, so we can write the long plasma half-life, all right? Then yes, once again, I stands on, we can write the I stands on the interfere, but at least we need to remember the IP3. inositol triphosphate formation inhibits or interferes. So within the bracket, just write it down that interferes with IP3 formation, and it says that also the interferes with the cyclic MP formation. Yes. So what you can write, basically we can write this all together. That would be helpful. All right, just write it down that IP3, yes, and also plus, that is interferes with the cyclic MP formation. Interferes with the cyclic MP formations as well. So just write it down, the IP3, just you need to remember. And T is so important here. This is so important of the T stands on, just write it down, the T stands for the tremor, my dear, yes. So usually the fine tremor happens in therapeutic dose of lithium. Therefore sometimes we are prescribing the patients and making them very, very well to understand that the fine tremor is acceptable within the therapeutic dose. The side effects of the tremor, my dear. So next point is, yes, once again the T, we need to remember the T. Yes, once again just write it down, the thyroid enlargement. Thyroid or thyromegaly, we can write the thyroid enlargement. So it's thyroid enlargement or thyromegaly plus. But the patient will come up with the hypothyroidism. This is important. Hypothyroidism, just write it down. And T, once again, the T waves flattening or sometimes the T wave inversion, that's really important. And another T is so important, just remember T is nothing but the 3. Yes, but the answer is 3 means yes, the lithium blood level should be checked, normally 3. So just write it down, the T is 6. And also the 12 is important box, right? Just make it down, right, the 3, 6, 12, 3, 6, 12, all right, 3 months, all right, every 3 months that should be checked, and lithium level, and 6 months that is the thyroid function and the renal function should be checked every 6 months, and 12 hours post-dose. Here's the 12. And once again, the H should be remembered. H is nothing but the hypothyroidism once again. And once again is the I. I is very important here. Insipidus. Just write it down. Insipidus means diabetes insipidus, but this is nephrogenic. Next one, you see that U is nothing but the UGI upset. We can say UGI upset or upset, GID upset. We can write the GID upset or UGI upset means upset. You just GID upset, that will be fine, right? GID upset. GID upset is nothing but the nausea, vomiting, diarrhea. Just write it, nausea, vomiting, diarrhea, bottle pack. And next point is the M, my dear, this one stands is the M for megaly. We can write the M for megaly means the thyromegaly, right? Yes. And also if you just turn around the M, this is nothing but the W. So we can write the weight gain, all right, weight megaly. Yes. So this is the most important box that we have already discussed here about the lithium and the side effects, all them together, and also the mechanism of action. Yes, I'd like to talk a little bit further about the lithium, other boxes of the lithium toxicity, my dear. Just make the boxes of lithium toxicity as this box. The lithium toxicity, the SS boxes, my dear, this is very important. Just write it down, the lithium tox. I say that Li, and if I'm writing the lithium toxicity or lithium overdose, if something like that, so the lithium toxicity is nothing but. So before going to the lithium toxicity, my dear, I'd like to talk What about the drug overdose and what about the drug toxicity? The target of the drug overdose and the drug toxicity to make the patients to die. Yes. So toxicity means the patients will go towards the die or death. So the death is caused by the cardiac and also the brain. What I'm saying, the heart and brain, just remember, my dear, means the last target of any of the drug leading to the death is the heart and brain. What I'm saying, my dear, heart and brain. Just remember these one, because we'll study a long list of drug overdoses and also the toxicity, and we'll see that it will lastly affecting the heart and brain. Heart and brain, just remember. And these two effects are, yes, leading to the death. So if I'm saying the heart means the cardiac arrhythmias, and in the brain, yes, the brain arrhythmias means the epileptic seizures, confusions, convulsions, and coma and death. Yes. And also here is the ventricular arrhythmias leading to malignant ventricular arrhythmias, cardiac arrest and death. So yes, the death is the brain and heart. So remember, my dear, any of the drug toxicity, they will affect at the end as the brain and heart. What I'm saying, brain and heart. What I'm saying once again, brain and heart. Just remember. So now talk about the lithium toxicity, right? What I'm saying, my dear, is very important box. The lithium toxicity is nothing but, just write it down, the boxes. If I'm saying the brain and heart, yes, what I'm saying, the brain and heart means the course tremor, just write it down. Course tremor plus seizures, just write it down, the course tremor plus the seizures. Course tremor plus seizures. Plus minus cardiac. Maybe the T wave flattening and also sometimes the T wave inversion. So this is very important. Very rarely the arrhythmias. So what I'm saying, the lithium toxicity is nothing but the course tremor plus minus seizures. Just make this box. So what I'm saying, the course tremor plus seizures. Course tremor plus seizures. Course tremor plus seizures is a lithium toxicity, remember. Very rarely I say the heart effects is a plus minus. If I'm writing the plus minus is the heart, just you can write. But the course tremor plus minus plus seizures is a diagnosis of lithium toxicity. Some of the precipitating factors why this happening of the lithium toxicity is, just write it down. Lithium toxicity precipitating factors. If I'm writing the precipitating factors, so before going to the precipitating factors, my dear, I would like to talk a little bit further so that we can understand very well. So what is that? Remember your studies in your school life. In a periodic table in your chemistry that you studied, remember the K, all right. Sometimes I used to teach my students, right, the Lina K. Who is Lina? Means the Lina K floats in the water. Means this lithium, sodium and potassium in the same periodic table in your chemistry. Remember the chemistry. These are floats on the water. So Lina K floats on the water. We can remember. Means what I'm saying, this lithium, potassium and sodium have a very good relations with the water. But what happened in our body? We have the extracellular fluid, the sodium enriched instead of potassium is an intracellular enriched electrolytes. But in contrast, lithium is not present in our body. All right. But if we take the lithium for a long time, so there is a chance of water along with that, the lithium will be retained in our body. So that's why there is a chance of weight gaining like the sodium. But it needs a long time to take the lithium. So that's why we have got, right, you see the Magali, right? Just remember the Magali. Yes, weight gaining. So lithium, we got it. So what I'm saying, so lithium have a very strong relation with the water, like sodium, like potassium. But sodium, lithium, because of lithium is very strongly bind with the water, so lithium itself is hydrated. And another important thing is that the lithium passing to the kidneys. When it enters in the bodies, it excreted through the kidneys. So how can you make the lithium toxicity? If you can make the water is less in our body and kidneys working not properly, so that we can make lithium toxicity. What I said, water less in our body, it does mean the dehydration. We can write the dehydration. And kidney is not working means the renal impairment or renal failure due to any causes. So what I'm saying is, once again, the lithium toxicity is nothing but dehydration. So dehydration due to any causes means the vomiting, diarrhea, whatever. But one of the most important things, that is the diuretics. And especially the diuretics are benzophenolthiazide. Just write it down, benzophenolthiazide diuretics. Benzophenolthiazide diuretics. And next point is, you see the renal failure. So we are writing the renal failure. Yes, or renal impairment. We can write the renal failure or renal impairment. Impairment due to any causes. One of the most important drug, that is the ACE inhibitor or ARBs, that we need to remember, because very hot topic for the exam, that can cause the renal impairment. These are very hot topic, as because in your notes you'll see the drugs, it is written the lithium toxicity precipitated by the dehydration, renal failure, diuretics, ACE inhibitors, and metronidazole. So my idea that we need to remember the drugs causing, of course, the lithium toxicity. So another drug is, this is in your notes, you can write the metronidazole. Just make a box. The precipitating factors is nothing but these two, means the dehydration and renal failure or renal impairment. As because it is metronidazole, this is ACE inhibitors and ARBs, this is diuretics and this is diarrhea. So what I'm saying, definitely lithium toxicity will produce the MAD. And MAD means, yes, the cold tremor and the seizures. This is the bundle pack So we can remember the MAD is a mnemonics of lithium toxicity, the summary talk. Next point, the how we can manage the lithium toxicity. So let's talk about the lithium toxicity management. So if you can see the lithium like L, lithium like this one L, all right? But what I'm saying, lithium toxicity is nothing but L just like 1, 2, 3, and 4. This is a very important numerical mnemonics, my dear. We'll see today how the mnemonics means the number categories of the mnemonics will be helpful to remember all the toxicity and all these features all together. So let me start by what does the lithium toxicity management means. 1, 2, 3, 4. So 1 does mean lithium level up to 1 is a therapeutic level. We can write it, right? 2 is a 2 for toxic, means greater than 2 is toxic. So we are writing up to, we are writing greater than. 2 is a toxic level. If lithium level greater than 3, the treatment should be started with the IV normal saline plus minus, sometimes you're using IV sodium bicarb plus minus alkaline. We called it alkaline diuresis. If the lithium level greater than 4, the treatment choices should be the hemodialysis. So once again, what I'm saying, the lithium toxicity is nothing but the 1, 2, 3, and 4. Say with me, lithium toxicity is nothing but the 1, 2, 3, and 4. Lithium toxicity 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Lithium toxicity. 1 means yes, the up to 1 means yes, the therapeutic level. You see it is rated in the 0.5 to 1 millimole per liter is a therapeutic index. Sometimes a greater than 2 is a toxic level. Some books writing more than 1.5 in your notes as well. And greater than 3, of course, this is the treatment that IV normal saline. Yes, means we know why IV normal saline we are giving, because we already talked about that, the dehydration. So what is the treatment? Of course, the IV normal saline. And these IV normal saline, yes, once again, will cause the dehydration and definitely having chance to relieve some of the symptoms and the features of toxicity. And sometimes you have seen the IV sodium bicarb or alkaline diuresis is helpful. That is important. If you give the IV sodium bicarb, so you are making the blood is alkaline. So the urine will be alkaline. So in this alkaline environment, lithium excretion will be increased. So that's why you're giving us some of the IV sodium bicarb. And also the last but not the least, that is the hemodialysis if it is the greater than 4. So that is called the lithium toxicity is nothing but the 1, 2, 3, 4. I'd like to talk a little bit further, that is about the lithium and the lithium toxicity. Here's mine, let me start by first box, all right, once again. What is the first box? That is the lithium used as a prophylaxis in the bipolar disorder and refractory depression. Second box is very important box, my dear, that is the lithium. Lithium, all the features that we put, the lithium is nothing but the lithium mnemonics itself. So L stands for the long plasma half-life, I for IP3 is a very hot topic for the exam, interferes the IP3 formation and also interferes with the cyclic AMP formation. And T for tremor is a fine tremor, T for thyroid enlargement leading to hypothyroidism, T wave flattening and sometimes a T wave inversion, and T is a 3 bundle pack, is a very important bundle pack, 3, 6 and 12. And H stands on, you see the hypothyroidism, and H also we can write the hours, that will be also helpful. We already talked in another video clips, that is 12 hours post dose that we need to take the blood sample to monitor the serum lithium level because of the narrow therapeutic index. All right, next point you see, that is the I for insipidus. I for insipidus, that is the DIN, diabetes insipidus nephrogenic. U for upset is the GID upset, that is the nausea, vomiting and diarrhea. M for megaly, that is thyromegaly, and also the weight megaly means the weight gain. So among all the lithium talk, what are my advices, my dear? This is very important, that we must remember I for lithium. You see the I having lithium, L-I-T-H-I once again. So lithium having the 2 I, so we must remember I for insipidus must. What I'm saying? Lithium causing diabetes insipidus nephrogenic. Lithium causing diabetes insipidus nephrogenic. When we'll study in another chapter diabetes insipidus nephrogenic, the causes, that one cause that we must remember, of course the drug causes, these are lithium, must remember, my dear. So once again, what I'm saying, the lithium causing the diabetes insipidus nephrogenic, and U for upset and M for megaly and thyromegaly, but it causes the hypothyroidism. A small boxes of regarding the 2 drugs causing the thyroid abnormalities. So my dear, just write it down. That is the amiodarone, just make a box, a side box, amiodarone and lithium. Amiodarone causes both the hyper and hypothyroidism, but in contrast, lithium causes hypothyroidism but having thyromegaly. So this is a compare and contrast box that we need to remember, my dear. And another thing, you see the fine tremor in therapeutic dose, but the coarse tremor in toxic dose. So make a lithium side box, lithium causing fine tremor, lithium causing coarse tremor. Just say with me, lithium causing fine tremor in therapeutic dose and coarse tremor in toxic dose. Therapeutic and toxic. So this is another important box, my dear. You see that the thyromegaly and weight megaly means the obese or weight gain is another features. Third box, you see the lithium toxicity is nothing but the coarse tremor, seizures. Brain and heart, plus minus heart, sometimes the arrhythmias. So that's why I say the plus minus heart. Sometimes plus minus arrhythmias. But the coarse tremor plus seizures equal to lithium toxicity. Say with me, lithium toxicity equal to coarse tremor plus seizures with or without arrhythmias. Number 4, the lithium toxicity precipitating factors are the MAD. I said and I discussed about how the lithium toxicity precipitating, alright, how this lithium toxicity is happening. How this lithium toxicity is happening. So yes, once again, the dehydration and the renal failure, renal impairment. Dehydration, renal failure, renal impairment. So dehydration, diarrhea, diuretics, and renal failure, renal impairment is the ACE inhibitors, ARBs, and metronidazole. And there are a long list of drugs also can be responsible what causing basically the renal failure and renal impairment can cause the lithium toxicity. Alright, so yes, ST inhibitors and ARBs and metronidazole is a very hot topic for the exam. That's why you put in mnemonics, there is a MAD can cause the lithium toxicity. M for metronidazole, A for ST inhibitors, ARBs, D for diuretics, D for dehydration, D for diarrhea. You can remember. Lithium toxicity management is a very hot topic, right? Among all the things that we are discussing here, we need to remember 1, 2, 3, 4. So lithium toxicity is nothing but 1, 2, 3, 4. Remember, lithium like 1. Alright, so 1, 2, 3, 4 is a lithium toxicity. 1 means therapeutic level within the range is the up to 1, and 2 is the more than 2 is the toxic. 3 means IV normal saline is the treatment of choice. Rehydration is the treatment of choice. With or without IV sodium bicarb causing the alkaline diuresis, yes, can cause the increased excretion of the lithium through the kidneys. And next part, if it is more than 4, the severe toxicity, my dear, a chance of severe toxicity means the devil can develop the coarse tumor in the sages along with the heart or cardiac arrhythmias, and that the more than 4 means hemodialysis. We should go for hemodialysis. Yes, and the compare and contrast box for the amiodarone and lithium. Amiodarone can cause both the hyper and hypo, but lithium can cause only the hypo. Lithium causes only the hypo. And with the thyromegaly. And number 7, lithium in therapeutic dose causes the fine tremors, but the coarse tremors in the toxic dose. So the summary talk, my dear, yes, once again, the lithium itself is a lithium long plasma half-life. I for interferes, IP3. Just remember, T for, this is the most important thing that we must remember. T for T wave flattening, T for 3, 6, 7, 12, and T for thyromegaly as well as the hypothyroidism, and T for fine tremor. Once again, H for hypothyroidism, H for hours, the 12 hours post dose. Once again, I for once again insipidus, diabetes insipidus, and U for upset. Remember, E for upset. So upset means the GI upset, there is a nausea, vomiting, diarrhea. So nausea, vomiting, diarrhea, lithium can cause itself. It's a side effect. So itself causing the side effect, there is a nausea, vomiting, diarrhea, that can lead to the toxicity further if the overdoses happen. So yes, feel it. So this can cause the dehydration leading to the lithium toxicity itself. So that's why the GID upset, and M for megaly, that is the thyromegaly, and M for once again, just M just revert, so it will be W. So once again, W means weight gain, means the megaly, alright. So yes, my dear, the boxes are, these are very important boxes, starting with the lithium. First box is a lithium means bipolar, LAR. Lithium means LAR, means a bipolar disorder and refractory depression. Second box is very important. Yes, the lithium itself is a lithium, but the diabetes insipidus, this box must be remembered, and 3, 6, 12 must be remembered here. Next, third box is the lithium toxicity, the coarse tremor with the seizures plus minus hard. Coarse tremor plus seizures is the diagnosis of lithium toxicity. Lithium toxicity is the MAD, precipitating factors, and lithium toxicity means the 1, 2, 3, 4, and last the box, the amiodarone, lithium, the compare and contrast, amiodarone, hyper and hypo, but lithium only the hypo. Next point is the lithium in the fine tremors in the therapeutic dose, but the coarse tremor in toxic dose. I hope that this summary talk, the summary boxes and the colorful boxes, my dear, it will be tremendous helpful. Thank you very much. If you like our videos, don't forget to subscribe our channel and click on bell button to get more updates.